Breast cancer is not just a disease. It's a difficult struggle tied to the lives of millions of women. Every year, around 2.3 million women worldwide are newly diagnosed with breast cancer. And tragically, nearly 700,000 women lose their lives to this disease. In the United States alone, there are about 300,000 new cases every single year. But breast cancer today does not always mean death. If it's detected early, it can be treated and survival is possible. So let's take a closer look. What exactly is breast cancer? Why does it happen? What are the symptoms? How is it treated? And what is the future of breast cancer research? Chapter 1. What is breast cancer? Breast cancer begins when abnormal cells in the breasts start to grow out of control. Most often, it begins in the ductus, the tubes that carry milk, or in the lobules, the glands that produce milk. At first, it may appear as a small tumor, but if not detected in time, it can spread to the lymph nodes and eventually to other parts of the body. This spreading is known as metastasis. There are different types of breast cancer, including ductal carcinoma in situ, or DCISAN, early stage that hasn't spread; invasive ductal carcinoma, or IDC, the most common form, which spreads more easily; invasive lobular carcinoma, or ILC, which begins in the lobules. Triple-negative breast cancer, a harder-to-treat form that doesn't respond to hormone therapy. Chapter 2. Causes and risk factors. Breast cancer has many causes, and several risk factors increase the chances of developing it. Age. The risk rises as women get older, especially after age 50. Genetics. Mutations in the BRCA1 and BRCA2 genes are some of the most well-known causes. Family history. If a mother, sister, or daughter has had breast cancer, the risk more than doubles. Hormones. The effects of estrogen and progesterone play a role. Lifestyle. Heavy alcohol use, obesity, and lack of physical activity can all increase risk. Radiation exposure. Women who have had radiation therapy for another cancer may face higher risk. Early menstruation and late menopause. Longer exposure to hormones also raises the risk. Chapter 3. Early symptoms. When breast cancer is caught early, the chances of survival are much higher. Some common warning signs include a hard lump or mass in the breast, changes in the size or shape of the breast, dimpling or pulling of the skin on the breast, a nipple that turns inward, or unusual bleeding or discharge, redness or flaky skin around the nipple, swelling in the lymph nodes under the arm. It's important to remember, not every lump is cancer, but no one should ever take a chance. If you notice a change, see your doctor right away. Chapter 4. How is breast cancer diagnosed? Doctors use several tests to detect breast cancer: a mammogram, an X-ray image of the breast; ultrasound to determine if a lump is solid or fluid-filled; MRI for more detailed imaging; biopsy taking, a small tissue sample for lab testing; genetic testing to check for BRCA mutations. In the United States, it is strongly recommended that women begin annual mammograms starting at age 40. Chapter 5. Treatment options. The treatment for breast cancer depends on its type and stage. Surgery. Sometimes doctors remove only the tumor, called a lumpectomy. In other cases, they may remove the entire breast, which is known as a mastectomy, radiation therapy, often given after surgery to destroy any remaining cancer cells. Chemotherapy. Strong drugs designed to kill cancer cells throughout the body. Hormone therapy, used to block estrogen and progesterone, which some cancers depend on to grow. Targeted therapy, drugs that specifically attack certain proteins or genetic changes in cancer cells. Immunotherapy, treatments that strengthen the body's own immune system to fight cancer. Thanks to advances in medical technology, many women today are not only surviving breast cancer, but also returning to full, healthy lives. Chapter 6. Prevention. Breast cancer cannot be completely prevented, but the risk can be reduced significantly. Stay physically active with regular exercise. Eat a healthy diet. Avoid smoking and limit alcohol. Maintain a healthy weight. Breastfeed, if possible. Get regular mammograms. If there is a strong family history, consider genetic testing. In fact, in the United States, research shows that nearly 40% of breast cancers can be prevented through lifestyle changes. Chapter 7. Breast cancer in the USA. Breast cancer is the most commonly diagnosed cancer among women in the United States. About 1 in 8 women will face breast cancer at some point in their lives. Each year, around 280,000 women are newly diagnosed. Nearly 43,000 women die from the disease. But when caught early, the 5-year survival rate is close to 90%. It's also important to note that African American women face the highest death rates, largely because their cancers are often diagnosed at later stages. Chapter 8. The future of research. Scientists are opening new doors in the fight against breast cancer. Liquid biopsy, a simple blood test that may detect cancer early. AI-powered mammograms, artificial intelligence helping doctors find tumors more accurately. Genomic therapy, targeting the genes that drive cancer growth. Vaccine research, the possibility of a vaccine to prevent breast cancer in the future. CRISPR, gene editing, cutting-edge science that may one day stop cancer by rewriting DNA. In the coming decade, treatments are expected to become safer, more precise, and more widely available. Breast cancer is frightening, but it is not unbeatable. Awareness, early detection, proper treatment, and modern technology together can save countless lives. If there is one message to remember, it is this: every woman must be aware of the changes in her own body, because when breast cancer is found early, it can be defeated. Together, we can fight breast cancer, because every single life is priceless.